Okay, when we get ready to attach the transducer kit to the baby, of course we need to maintain sterility. We're going to turn the stopcock off to the baby. Make sure we're attaching with no air bubbles in the system. The system has to be complete column of fluid. There can be no air bubbles or else we won't get an accurate reading on the blood pressure, and also that's just not safe. So when we are ready to zero, we have to find the cord first. Make sure you have it available. It is in the green procedure cart that the nurse practitioners use. You're going to plug it into the monitor on the side. There's a maroon thing that says press. Plug it in, and after it's plugged in, the monitor will eventually recognize something is plugged in there. Then you connect the phone jack looking cord in the end, and it'll eventually come up. Oh, see, it's trying to see it. So we're going to zero the transducer. To do that, you have to remove the syringe, turn the baby off first, and the syringe has to be open to the atmosphere. Once it's open, you push the 0 button on the monitor and you wait. Oh, sorry. And see, it shows that it was done and we have a 0. Then we're going to reattach the syringe, of course removing any air bubbles that could possibly be there. And then we're going to turn off the syringe port and open the baby. That will start giving us a reading. Now obviously right now it's negative because the baby is not real. But if you have negative numbers on a real baby, then it wasn't zeroed correctly. If for some reason you don't have a flush syringe on here, you need to have a non-vented yellow cap, because the ones that come in the system, which are white, have a hole in them, which won't give us an accurate reading, and also that is an opening to an arterial line, which is not safe. The transducer needs to be zeroed every shift and anytime the baby's position is moved. As far as positioning of the line itself, we roll a blanket up that's about the height of the baby's heart, and we position it next to the baby's chest. We tape it down so it's not moving all around, because when it moves, it's going to give you different numbers. You can see on the little wiggly lines, when it's moving, it's giving us numbers. So we need to have it in a place that is secure. It needs to be at the infant's chest level, and anytime the baby is moved for whatever reason, like if you're doing an x-ray or if you're changing fluids, we need to re-zero the system, and then again at every shift change. I think that is everything.
Do we zero it during report with the oncoming?
I think that's probably a good time to do the zeroing so that everybody is on board with make sure the 0 is done and making sure that everything is working appropriately. And that way, if you have questions or you run into issues, you have someone right there to ask questions of. Any other questions? Alrighty.